Welcome everyone to today's interview. I'm Nikolas, Digital Marketing Manager at WhatClinic.com, one of the largest medical directories in the world for elective care, like plastic surgery, hair transplant, medical aesthetics, etc. In this series of interview, we get to know clinics from all around the world, especially from countries that are considered to be medical destinations. Today, I have with me Charles Hamilton and Dr. Hala Ibrahim from the Seneca Clinic, who specialize in hair transplant. And recently they opened a new branch in Athens, Greece, the place where I am from. And we're going to talk about the clinic and also some frequently asked questions by patients about hair transplants. Charles Hamilton is a senior consultant for the Seneca Hair Transplant Clinic, and Dr. Hala Ibrahim is the medical director of the Glasgow branch of Seneca Hair Transplant Clinic. So, hello, Charles and Dr. Hala.
Hi.
Thank you very much for accepting the invitation to have this interview with me. I'm really excited to talk about hair transplant because at some point I think I'm gonna need it as well.
Thanks for having us.
So, could you please tell us a little bit more about Seneca? What is Seneca, when it was introduced, about your medical staff and the treatments that you're offering?
Yeah, I mean, as a clinic, we have over 35 years of experience, and we focus on being pioneers and leading the way for hair restoration. We want to offer hair restoration breakthroughs with advanced techniques, but always focusing on the client's individual needs. So we want to make sure that we're trying our best to offer the most dynamic approach to fixing people's hair loss issues.
That's great. Nice. And I've seen that the Seneca Clinic has been awarded with the WhatClinic Patient Service Award for 2018, 19, and 20. So congratulations for this.
Yeah.
And in order to get this award, patients should rate you with high ratings. So congratulations. This is an award that you got for providing excellent care. If you can sum up the advantages that Greece is offering compared to other medical destinations like Turkey, what these advantages would be, especially for your clinic?
Well, first of all, it's safety and results. You have, as I mentioned, a highly experienced doctor performing the procedures. There's guarantees for these results as well. You're not just rushed into the clinic and put on a flight straight away back home, never to be seen again. Duty of care is important for everyone. Evaluation appointments were with you from the start of the procedure right until the final result as well. Yeah, I would say it's a more in-depth experience and relationship we have with every client.
So to sum up, someone who will come to Greece, to your clinic to get their hair done, they will have full attention by specialized medical personnel, and from the doctor who is going to do the operation, the doctor, right?
Yes.
We think about hair transplantation as it's a medical procedure from start to finish, right from the diagnosis when we see patients. Proper diagnosis is made, and then the procedure is done by a doctor. It cannot be done by an assistant or a technician or any just person that come in, get probably a week of training and off you go. No, this is completely different. We see it as a medical procedure. Doctors are doing the procedure from A to Z.
That's great. So full attention from the doctor to the patient, and high safety in the procedure.
Absolutely.
That would be the advantage. Of course. From which countries patients are coming from?
Oh, there's many, to be honest. It's very popular for people to come from Israel, the Middle East. Also, more over Central Europe and even the UK and Scandinavian countries. So a lot of people, I mean, with flights every day, it's quite easy to access, especially to the likes of Athens, and it's quite popular with many different countries.
And how international patients can find you?
Yeah, most people are probably searching by Google, social media. We've got a good presence in social media, but word of mouth is very, very key.
Absolutely.
We do. Anyone that's an extremely happy client will talk about the results, and then friends, family, colleagues, they then ask to find out where they had it done.
Yeah, the word of mouth is the best advertising that we can get, always. Exactly.
But WhatClinic as well. WhatClinic also helped with many clients finding us.
You want to be exposed to people as well.
We're happy that we can help you. Thank you for mentioning this. Is it hair transplant actually a permanent hair loss solution? This is something that many people are asking, especially online. Doctor?
Yes, the answer to this is yes. It is a permanent solution. The hairs that are transplanted from, they're basically taken from your donor area, which is at the back of your head, and then transplanted to the recipient area where it is needed. Is it permanent? As I said, absolutely it is permanent. So you shouldn't really be losing the hair, because the hairs from the donor areas, basically they're resistant to your male hormones, which is in most cases the reason why you lose the hair. So the cause of baldness.
Okay, great. And what are the most popular and effective hair transplant techniques?
So there are different types of, say, technique to hair transplantation. We are using the most advanced way of doing the procedure, which is the direct follicular extraction. The word direct is basically refers to the implantation part of the procedure. So when we extract the grafts from your donor area, we then load it to the implanter and then directly implant it in the recipient area.
And do you offer all these techniques in Seneca?
So this is the direct FUE technique, which is the technique that we use all the time. There are other types of technique that we've probably tried over the years, but we know that this is the most effective way of doing the hair transplantation, and we're sticking to it.
There's three main advantages. So one, it looks far more natural in terms of the results. It's safer as well, the way that we're doing the extraction and the implantation. And we can get one of the highest densities, depending on the client's donor area and the industry as well. So it's, those I would say, would be the three main advantages to choose a direct FUE over a regular FUE or older technique, strip surgery.
We're also able to control the angles, the direction of the hair, where the hair needs to go. We also are able to create much denser implantation as well, which is obviously a fantastic advantage over the older techniques.
That's great. This is very informative. Really, I didn't know so many things about the direct FUE. So, and the patient that is coming to Greece to have a direct FUE, how many days usually needs to stay in Athens?
Usually we would suggest to arrive maybe at least 1 day before the procedure, have the procedure. Some procedures take a couple of days, and then you can travel back again after another couple of days. Personally, I love Athens, so I would stay longer.
That's a great choice. And the whole hair transplantation is done during 1 day, or it may be needed to go for a second day as well?
So that will depend on, every person is different. That will depend on the size of the area that needs to be treated, and also on the donor area as well. So, but usually we do it in 1 day. But if the person requires huge number of grafts, then we would rather do it over 2 days. And the reason for that is that so we can be much safer. It's much more convenient to the patient. He or she will have a very, very relaxed 2 days instead of just doing it in 1 day. Will be very tiring to the patient. And also, of course, probably most importantly, the safety aspect as well. If we do it over 2 days, that means we don't need to inject, for example, just an example, lots of local anesthetics, which is obviously, we are restricted to the amount of the safe local anesthesia. So that just makes the whole procedure much, much more convenient to the patient, as well as, of course, the staff. So everybody will perform at their best every day. But most of the times, we only need to do 1 day.
And depends on the number of grafts at the end of the day.
That's true. Yeah.
So for international patients, when they are looking online on your website, the prices that they will see, the packages that they see, do they include accommodation, or is it something that the patients should arrange by themselves?
Oh, no. So when you're booking, it's not just the accommodation is included, but you also have the transfers. So if you're arriving at the airport, someone will be there to pick you up, take you to the hotel. Someone will then pick you up from the hotel, go to the clinic. And we can also have some PRP treatments included as well in certain packages. But it's usually a full package that we offer for people traveling.
Great. So you take care of everything. The patient should not worry about anything. That's great. That's nice. Because also Greece is known for their hospitality, and this is a great indication about how they will feel in Greece. So something that I found online and people are asking a lot, are there any side effects of hair transplant? And if there are some, when do they may appear?
These side effects are just basically considered minor. So things like swelling, you expect it to swell like around day 2 or so, and that's just part of the healing process. A little bit of bruising, of course, we use local anesthesia, so the needle size can have a tiny small bruise, which I think is really not a great deal at all. Other side effects, like, of course, involving the local anesthetics itself. Very, very rarely you get patients who are, say, for example, sensitive to the local anesthesia. That's why patient selection is very important. The screening during the consultation is very important. We ask about any risk of allergies, any history of any allergies to the local anesthetics before. So things like that. So patient selection is vital to make sure that they go through the procedure with very minimum, if at all, any risks at all.
That's clear. So as I understand, if the procedure is done correctly, the side effects will be minimal compared to the long-term results that the patient is going to have with the hair transplantation.
Yeah.
So how long it may take to see the full results?
Most people will, so they shed all the hairs that's transplanted to start with. Usually that happens around 2 months' time. But almost immediately, the follicle starts to produce the new hair. So by the time it's 4 months, they should start seeing some noticeable result, let's say. This will continue to improve, and it will continue to, they'll start seeing more and more density, more and more hairs growing out. By the time it's 6 months, I would say probably most of them, especially if we're using the direct FUE, they'll start seeing almost like 60% of the results, something like that. But the final results is around 12 months. And sometimes it's a little bit longer, but around 12 months, usually they start enjoying the much denser
the full potential of the surgery. Is it really necessary to save your hair before a hair transplant, to have a hair transplant, actually?
Yeah, the short answer to this is no. We can perform the procedure, shaved, non-shaved. It doesn't really matter that much in most cases. However, we do encourage people to shave if we require a large area to cover. Basically, when of course if you shave the whole area, that gives us a much bigger surface area to take the grafts from. However, some people who don't really need that huge number of grafts, then we can just settle for either a donor shave. This is another way of doing it. So we just shave the donor area, but the patient get to keep the rest of their hairs unshaved, and we can just, because again of the precision of the implanters that we use, we can very safely go between the hairs, and we just add density on the existing hairs.
This is impressive, actually.
To shave, so they get
very
to
precise.
enjoy the their hairs and without actually having to shave.
So about the new hair, can the transplanted hair turn gray, like as a natural progress of the hair?
Yeah, so the hairs are literally transferred from your donor area to your recipient area. This hair will maintain its characteristics, let's say. So if it is a black hair, it will stay black. Once it's time for it to turn gray, it will turn gray, whether it is on your donor area or it's in the transplanted area, let's say.
And about the new hair, are they sensitive? I mean, when a patient will go to the barber to have a haircut, should they tell the barber to be careful, not to pull them, not to touch them so much?
I get this question asked all the time. I suppose they feel like they're so precious, so they have to look after them. The short answer to this question is there's no restriction. Okay, so they can just do whatever they want with their hair in terms of styling it. Even if they want to apply a product, of course, it's best not to put chemicals on your hair anyway. However, there's no restriction. So you can treat it the way that you're actually treating the rest of your hairs. If anything, actually, the transplanted hairs are even more resilient. It's a bit stronger than the weaker ones that they're,
So I get some questions about using finasteride, because many patients before hair transplant, I do it as well, they're using finasteride. So before, actually after the procedure, do they need to keep using finasteride if they were using it before the procedure?
Yeah, so if they started the finasteride or propitious, the other name, before the procedure and they're tolerating it well, in fact, it's a great idea for them to continue using finasteride afterwards. And it's not for the transplanted hairs, actually, it's more for the rest of the hair. So you would want to keep these hairs for as long as possible. You want to maintain the area that already has your native hair. So it's not the transplanted area that we're talking about, it's your native hair. So you want to keep it for as long as possible, and that's to enjoy the result of the direct FUE for as long as possible.
And is it something that can affect the results of a hair transplant, for example, smoking or drinking alcohol or excess exercising at the gym?
Yeah, so let's start with smoking. Probably, okay, of course it's not healthy to smoke, so and it's known that it can affect a little bit the ability of your, let's say, your hemoglobin to provide the oxygen to the hair. So it's not a great thing to do for your hair to start with.
Yeah.
For the procedure itself, it is advisable if you can stop smoking, like let's say, or reduce smoking before the procedure, just so your you're giving the best chance for the transplanted hair to survive, of course. So you're doing your best bit. After the procedure as well, just for the healing, again, we know with any surgery, it's best not to smoke straight after, and that's just for the wound healing. Does it mean that your procedure is going to totally fail? No, of course not. As I said, you're just needing to, it's good to give the procedure the best chance for the best possible result. Alcohol, again, it's just, it can increase the risk of swelling a little bit. So it's best, again, to not to take or drink that much alcohol straight after, just to minimize the swelling. There are a few other things that we like in the aftercare, like when can you go back to the gym, things like to avoid just after the procedure. They're all really straightforward things, and we do inform our patients even during the consultation what can not do this first 4 days or so, and then when can they go back to the gym, etc. But none of them are really a big deal things.
So the patient is being informed during the consultation about what to expect after the
Yes, of course, because you'd imagine that they would need to book their session, so they're prepared as well. So they know after the session they can't, for example, they can't wear a hard hat straight away after the procedure. So these precautions really that they need to think about before they're doing the procedure, so they're prepared.
Okay, great. So one of the main concerns of patients is about the transplantation done by technicians, something that is very popular in Turkey. So I know we discussed this briefly at the beginning, but could you tell us a little bit more about what is the procedure that Seneca is following? Do you have technicians, or the doctor will take care of the patients from the beginning to the end?
This is absolutely vital. We don't take this lightly at all. As I said in the beginning, we look at hair transplantation as a medical procedure from start to finish. I did mention a few things about the possible side effects, etc. And I did mention that as a minimally invasive procedure. Yes, that's all true. However, if you say, for example, patients on certain medications that we know it will, for example, interact with the local anesthesia. For these patients, they need to go through they have to have certain advice when to stop this medication, how to do with this, and that's just to minimize and make it safe the way it should be, minimize any risk of side effects. So if this is not being done correctly, then the safe hair transplantation procedure, it can turn into a disaster. Of course it is. It can be. Yeah. So that's just during the consultation and patient selection, let's say. During the procedure, again, it is a medical procedure. It's a surgical procedure, even if it is a minimally invasive. We feel like it has to be done by a medical personnel right from the beginning. And you cannot have two different teams, let's say, a medical and non-medical team, dealing with the same person as well. So from designing a hairline, the person who's going to do the procedure should be the one who's designing the hairline. How can you design a hairline and then ask somebody else to do, for example? It's just, everything is linked. Everything is very vital and important for a very good result at the end. If I'm not the one who's extracting these grafts, how am I meant to be the one who's implanting them? Okay. And if I'm the one who's making the decision, how come I'm not the same person who's actually implanting the follicles and for example, we don't do the slits anyway. So we do it directly. But what I'm trying to just compare is this is the practice like almost everywhere else. but we don't follow that. So that it has to be done by the same brain, by the way. So you design the hairline, you design the area that needs to be implanted. You count how many grafts you require. And then you extract these grafts. You're the one who's extracting them. You know how many doubles you require. You know how many triples, let's say, because they come in they're different types. Your follicles or the units themselves can have 1 hair, 2 hairs, 3 hairs. So if I only want, let's say, singles and doubles, if I'm only fixing a hairline, especially we see this with blades and things like that, then I want to extract only like certain number of singles, certain number of doubles. You can imagine that if somebody else, if I delegate this task to somebody else who is not going to be the one who's implanting it, it just doesn't make any sense. So I know exactly what I need. I will extract exactly what I need. And of course, we can talk for long about the skills and comparison of if the medical person is doing the extraction or a non-medical person doing the extraction. You can just imagine, okay? But anyway, so that same doctor actually will implant those grafts. So I know where the triples needs to go to give that nice density, and I know where the doubles should go to give that softness of the hairline, and then just to finish with the singles at the very end of the hairline. So we strongly believe that the procedure has to be done by the same doctor from A to Z. And there's no compromise whatsoever.
I admire how passionately you're talking about hair transplant, and I can understand that in Seneca, you love taking care of your patients from A to Z and giving them the best result that they can expect. And
100%.
For sure, patients are going to who will choose Seneca Clinic and going to enjoy the full care and the full care from the doctors from the beginning to the end.
Yes.
One last question that I have for you. Oftenly, I hear about clinics offering guarantees about hair transplant. So what is a guarantee in hair transplant, and do you offer in Seneca a guarantee?
Yeah, so first of all, we always want to offer a safe outcome. So we do a full assessment of clients on a consultation to determine they are a candidate to go ahead. Once determined, we guarantee that they'll have a completely natural results, and a minimum of 90% of the hairs that are implanted will survive. On average, we get higher than this, but 90% is the minimum.
That's great. So to sum up, how patients can find and contact you on the internet if they want to get a consultation from you or to visit Greece and Seneca to have their hair done?
Yeah, so most clients will actually find us through our own website, and you can then have a consultation, organize it through WhatsApp or other types of video calls. Quite a lot of our clients will come through social media, through Instagram or Facebook. We've now just started TikTok, now that's now very
that's a great source
in people's lives. And obviously they can contact us through WhatClinic as well, which is good for us.
And for everyone who is interested in contacting Seneca Clinic in Athens, I will have all the details in the description of this video below. Their social media, their website, and of course their TikTok, which I'm going to follow you after the interview. So Dr. Hala and Charles, thank you very much for your time and for answering to all these interesting questions that I got from potential patients. I appreciate your time and maybe see you in Greece soon.
Yeah, sounds good. Thanks for your time.
Thank you so much. It was a pleasure.